We are so delighted to welcome Professor Elizabeth Anderson.
Well, thank you very much for inviting me to come and talk to you about my career in nursing. So I trained and qualified in the early 1980s in London in a very famous old hospital called St Bartholomew Hospital. And in those days, we still wore those wonderful crunchy uniforms with all of the white fluffs and ruffs. But I trained in a very unusual way right from the beginning. I was actually selected to do a 4.5 year degree nursing program, one of the earliest nursing programs that had a degree content. So I was extremely lucky to do that course because right from the beginning, I had wonderful learning opportunities. So I went to university and gained a psychology degree at the same time as doing my nursing studies. So after working in an acute ward environment, I moved to another city in the middle of England, to Leicester, where I trained to be a midwife. And I worked as a midwife for a while, and then I became a health visitor. This is a public health recognised nursing role in the United Kingdom. And I had a very interesting time there where I had an unusual situation in 1 year to have 3 babies who died of sudden infant death syndrome. And I then used that moment to forward my understanding of this tragedy for families, and was selected to join a very prestigious group of researchers investigating the death of these babies at that time, where I gained my PhD and was part of something known as the Back to Sleep campaign, whereby we no longer put babies to sleep on their tummies, but on their backs. And our branch in Leicester was looking at thermal temperature regulation. And from there, my career took me in another direction, and I ended up becoming an academic and a teacher. And I have been teaching in a medical school now for 20 years. So half of my career in different types of nursing practice, and half of my career as an academic. So that's me in a nutshell.
Oh, thank you so much for a wonderful introduction. I was hearing your rich experience. I'm really interested in your career. So I've heard that you've taken psychology as a degree. From your experience, like how did it help to learn about the psychology and related to nursing?
Well, I do, and thank you for that question, because I think that what nurses always do is ask questions. I think nurses are never happy. We're constantly seeking to improve. And we have been a voice for change in many, many things. So, right at the beginning in my training, I was asked to go back into my clinical practice and do a dissertation and question what we were doing and why we were doing it. And I remember that very well. And I was introduced into theories, in particular, cognitive dissonance theory, the way in which we can have a knowledge about one thing, an attitude maybe that's another, and how we align those. And later, when I was a health visitor, all of that psychology was very much at the forefront of my work in trying to motivate people to change. And I have continually drawn on my psychology degree throughout my career, and latterly so in education, understanding about learning and how we learn. And I am now very active in the movement of interprofessional education. I passionately believe that nurses and medical students and pharmacists and therapists and social workers and others should understand each other so much better, so that we can practice better together when we're out in practice. And the psychology of how we understand one another, how we relate to one another, I continue to use to this day in my educational practice. And I think in this difficult year with the pandemic, we've learned a great deal about team working, and psychology helps us understand what is effective team working. So we can come at understanding the individual a great deal in our work as nurses. And I passionately stand in the social psychology branch of psychology because I think how we work with others is so very important.
Thank you so much. Yeah, it's so amazing that the psychology is like still in the basic of your like thinking and behavior and your approach. It's so amazing. Thank you. So I've heard that you've transitioned to the academic field from a clinical setting. Currently, what is your specific area of interest and what made you passionate about? Could you let us know about it?
Yeah, so I came into education through being a researcher, and I was researching into service design with a general practitioner who's become a working friend and colleague. And we were looking at why it was in an area of real disadvantage and where people were experiencing poverty and struggling, and there was not good equity of care, where inequalities in health were high, how we could encourage those people to take up healthcare services in an area where many women were not bringing their children for vaccination. And right now, there's a global vaccination program for COVID, and we really need to understand why people don't access services or take them up. So, in doing all of that work, I was charged with helping to establish some new teaching in medical education to help medical students understand more about poverty and disadvantage and team working, because poverty and disadvantage are things that have to be tackled by many different professions together. And in doing the service learning, I learned so much about the value of interprofessional working that I ended up coming into academia to champion interprofessional education, to help us advance the outcomes for patient care so that we will be smarter, quicker, better equipped to work with one another. So that has been a big side of my academic life, looking into how we conduct that type of learning. And I also have been involved in other types of research. I'm very interested in the patient safety space, and I've been doing some work there. And I'm passionately involved in patient and carer involvement in education. How can we better make sure that tomorrow's nurses, midwives, doctors learn from patients and with their patients during their learning journey? So I chair a patient carer group, and I feel very passionately about that. I've also done some research on inequalities in health and inequity and disability. So they're my big interests. More recently, I have a PhD student, and we're looking at mindfulness in the health and social care curriculum to help for resilience, to help personal practice, managing stress, and also a technique that now is becoming quite popular in clinical practice. So how can we help our patients to maybe adopt some of those ways of thinking?
With this challenging time, like, do you have any like suggestions from related to research field of how nurses and healthcare workers can overcome this challenging moment? Do you have any thoughts?
Well, the literature is rich at the moment with people publishing about what they've done to help in the pandemic. Here in the United Kingdom, we're about to see a new white paper, and it's entitled Working Together. I think we've learned a phenomenal amount about working together. I think we have cut through the problems with team working overnight. We've taken down barriers and we've shown how to come together. And I think the world of nursing can lead a lot of the research into this sphere, because maybe nurses have been asking for closer working relationships, particularly with doctors, for many years, and it's happened overnight in many, many acute care situations. But there is another big area for nurses to be doing research in at this time, and that's what's happened to the many people who've been locked down at home. So people looking after vulnerable people, so older people, people with disabilities. Many have felt lost, sidelined and ignored. And I think it will be the nurses that will be the ones that will be leading some of the work on answering the questions of how can we ensure that we don't forget our most vulnerable at this time, who are not obviously in hospital acutely ill with this virus, but nevertheless living at home with worries. And we have a plethora of people globally who are behind in their care. Maybe that's cancer care, or they're waiting for operations that have been cancelled. So we have a lot of work to do we not, to help all these people?
Yeah, it was so eye-opening to hear that, we tend to really focus on like front lines and patients at hospitals, but as you mentioned, like there are also like a lot of people who are staying at home and like dealing with their stress and physical symptoms. So yeah, thank you so
Yeah.
much for raising that point.
Well, I'll tell you one little story about that. So I have a teaching session with my fourth year medical students, which has sometimes been interprofessional, where I bring along carers. And we do a lovely session about caring, their legal responsibilities for involving carers. And I know nurses are so good at involving carers in everything they do. And the carers have asked for extra time because they want more time to talk to these future doctors about how they've been ignored during the pandemic and the pressures they've been under. And, many of them mothers with severely disabled children, and they've not been able to go to their special schools, they've not been able to go out. Many people unable to get out, maybe physically, waiting for hip replacements, they can't walk. And we had an outcry from them. So we've extended our teaching session so that they can talk about what's been happening to them.
Yeah, thank you for that amazing story. Finally, could you give us a message to nurses and nursing students who will become the future leaders?
Well, I feel very privileged to have risen up to be a nurse leader and to take on leadership roles in a variety of different places. I've sat on different boards and I've achieved many wonderful things. I think that the key thing for me is that we continue to ask questions. I think nurses push forward and have always asked the challenging, difficult questions. And I think at this time, the nursing profession will continue to do that. I have deliberately placed myself in a medical school to forward into professional learning because I passionately believe I am a different voice, and that's a good thing. And sometimes in nursing, we may feel alone in that we may have a view that's very different from those around us. But in the United Kingdom several years ago, after one of our very shocking inquiries into poor healthcare, we set up a framework of values called the 6 Cs, which I think have been known and adopted globally, but have been adopted by our National Health Service. And they are communication, care, compassion, courage, commitment, and competence. Those 6 Cs started from our nursing profession and have been adopted by everyone. And I think it speaks volumes for what nurses are, what nurses try to achieve, and our ability to come alongside and listen, because we are often the closest in the clinical moment to our patients.